So, guys, we're gonna start as a cognitive behavioral therapy. Okay, this is the second time we do it, but this time when we do it, we focus on a disease or a problem more than the concept of CBT, because lots of you have attended the CBT workshop with me, but this way we're gonna focus on, like, let's say CBT for depression, CBT for anxiety, for phobia, for OCD, for addiction. So we're gonna talk about CBT, and classify it or divide it into disease or problems. This is the main idea for cognitive behavioral therapy: is we change the thoughts, okay, and we expect that feeling will change, and then behaviors will change, okay. And to make it simple, which start with the thoughts, then it's gonna change the feeling, then it's gonna change the behaviors. Sometimes we start here and sometimes we start here, but we will talk about that later. But for now, if you are not familiar with CBT, let's focus on that we change here. And here is an example for someone struggling with depression. People who struggle with depression, they have depressed mood, loss of interest, lack of energy, lack of motivation, lack of self-esteem. These are symptoms of depression. So if someone has depression, when they wake up, they feel like a failure, worthless, they don't want to go to work. And if they assess their thoughts, they're going to tell you, there is no point of going back to work. I'm a failure, I'm unlovable, I will only mess up again. These are the thoughts they struggle with. And these kind of thoughts leads to negative feeling, like depressed mood, low energy, feeling tired. And when you have these thoughts and these feelings, you're gonna end up with negative behavior. You're gonna stay in bed, you will not go, you're gonna skip work, and day by day, you eventually gonna get fired if you don't attend your work or do your duties. So you see, and CBT, we try to change these kind of thoughts. No, you are not a failure. You are not unlovable. You are not a loser. Okay. And there is different ways to change these thoughts. And when we change these thoughts, the feeling will become more positive. And when the feeling become more positive, the behavior will become more positive. So this is the concept of CBT. Okay, but again, we are not talking about depression today. We talk about a different topic, but every time we will focus on the same ideas, but how we're gonna work on them to change, a problem or a mental health problem. For today, we will focus on some tips for CBT for phobia. For phobia, I don't know, this is exaggerated form of fear, like exaggerated and irrational fear. And there is hundreds of types of phobia or the fears that we have. I put here the most common one. Some people will have social phobia, like social anxiety. Some people like would collapse, in front of others if they're gonna give a presentation like this one, like a PowerPoint presentation. Some people have claustrophobia, which is fear of people, places that are closed. Agoraphobia, like the fear of places that are open, fear of airplanes and fear of flying, fear of spiders, fear of driving a car, fear of bridge, like driving a car over a bridge. They are fine with driving, but the problem is in the bridge. Fear of animal, fear of dogs, fear of water, fear of heights, fear of blood. You see, you send someone to do the lab work, annual checkup, and they collapse or they faint in the lab because they have exaggerated fear toward blood or injection. So you see, there is different, if you check thousands of types of fears, some of them are common, some of them are rare. Quick question on why does this cause, what are the causes of phobia? The strongest cause is genetic predisposition for anxiety. Usually people who have anxiety problems, they tend to have more phobia than others. Of course, a real traumatic experience. If you were bitten by a dog as a child, you will have phobia of dogs for the rest of your life. Not everyone will be bitten by a dog, will have phobia from dogs, but if there is genetic predisposition, it will add up to the risk factor. So you see, traumatic experience is one of the causes. If you have individual experience, also if you observe others going through the experience, if you see your brother was bitten, your brother or sister was bitten with a dog, you might have or form a phobia toward dogs. Also by information transmission, you hear from others, it's very common to get bitten by a dog, so you have phobia for dogs. So you see, you learn it from others, you see it, you experience it yourself. Also, there is genetic part of it. When I'm talking, sometimes I'll focus on social phobia, sometimes I'll focus on animal phobia, bridge phobia, or phobia from animals, from insect, but the concept that we're going to learn today, you can use it and apply it for different types of phobia. And even if it is, so again, if you have severe form of phobia, you can't fix it with a presentation like this. You will need, a therapist or a counselor to support you through the process of recovery. But if you have like mild, moderate phobia toward this stuff in life, this information will be very helpful. Anyway, so the symptoms of phobia, people will have uncontrollable anxiety. People will not be able to function when they are in the same place with the source of fear. They lose energy, focus, attention, concentration. People who have phobia, they know that it is irrational. It's irrational to get a panic attack when I see a spider. I know this is completely irrational, but I can't control it. Sometimes people will have panic attack and severe anxiety, and these are the symptoms of panic attack. Usually people, when they have phobia, they try to avoid the source of phobia or the source of fear. They have hyper attention or hyper focus toward this source of fear. They overestimate the threat of the problem or the source of fear. They underestimate their ability to cope with the source of threat or a source of fear, and they become hyper vigilant in the presence of the source of fear. Anyway, to summarize, they're going to have an anxiety toward certain things, and they're going to try as much as they can to avoid it. Okay, this is the symptoms of phobia. What is the treatment? We can give medication for short term. Okay. So it's very common to use beta blocker, for example, for people who have social phobia, or they're going to give a talk and they get, they have heart racing, they get dizzy because of the fears. So we give them beta blocker. If people have an anxiety with phobia, we give them antidepressant, and sometimes we give tranquilizers, which are like benzodiazepines, like Ativan. It's very common in my practice. People have phobia for airplanes, fear of flying. So we try to give them Ativan before the flight, during the flight, and after the flight. So because they become very tense and they become very anxious. And but anyway, the rule here for medication is very, short term, but the main treatment is the CBT that we are talking about today. Okay. And again, the ideas that I'm going to give and the tips, you can use it in any form of fears or phobia. The most effective treatment is exposure therapy, okay, which we expose you to the source of fear. Why you expose me to the source of fear? Because they find if you could avoiding it, it's going to get worse. If you keep avoiding it, it's going to reinforce the fear. But if you are exposed to it with especially gradual exposure, it's going to become less. or cause less impairment in your life. Because, for example, it's a fear of spiders. If you have fear of spiders, it can ruin in your life, because especially in summer, there is a spider, there is a, chances that you will see a spider in your office, at your home, in a park. And if you collapse or you faint because of the spider, that's gonna cause major impairment. Anyway, how are we gonna expose people to things? Sometimes we expose them real exposure. In vivo means in real exposure. So you expose them to the source of fear, with or without assistance. So with a counselor, with a therapist, with a family member. So you expose yourself to the source of fear. Sometimes we do it by imagination or visualization. So you tell the patient, okay, forget about it now. Just imagine that you are seeing a spider. Just imagine that there is a spider walking on the wall. Imagine there is a spider on your t-shirt. There is a spider on your arm. And then by just imagination, not real exposure. Maybe real exposure will be a secondary step. And lots of private practices now, they use VR, like virtual reality, like they wear this, and then you put videos or pictures for the stuff that you are have a problem with, to make it even like a real exposure. And the therapist will be sitting with you. Because let's say you have a spider problem, and then I can show you pictures of it. I can talk about it, but if I show you the spider in a video and I am sitting beside you, giving you some relaxation tips, it's gonna help with the experience. Anyway, the most effective therapy for phobia would be the graded or gradual exposure. Okay. For example, if someone have a phobia toward spiders, you create a hierarchy of situation where they're gonna face their source of fear. So you tell them, what is the worst situation you could encounter with a spider? They're gonna tell you, okay, no, you know what? If a spider is crawling on my skin, this is the worst thing I can imagine. So on a scale from 10 to 100, I would give 100 to a spider that is crawling on my arm. How about just thinking about a spider? No, this will be 10% or 10 out of 100. So we start with here, let's think about a spider, and then we try. So people who have phobia, sometimes just thinking about the source of phobia gonna make them very uncomfortable. So we start the gradual exposure. We start just with thinking about it. You tell me, okay, while I'm thinking about what should I do, I feel panic. We try to replace the negative thoughts about the spiders, and we try to replace the catastrophization with more rational thoughts. And we will talk about this later. But anyway, I just want to, in this slide, I want to show you how we can go gradual. So if you have social phobia, you can do the same thing. You create your own hierarchy. Maybe if you have a social phobia, you can start with talking with people, chatting with people online. Maybe then you can chat with people by voice. Then maybe by turning on camera and voice. Maybe then you can meet them in person. Maybe then after that, you can give a presentation to a 2-person. Maybe then you can give a presentation to 50. Maybe you can give a presentation to 1,000. So you see, everyone will have his own hierarchy of fears, and you start with the lowest. So you start with thinking about the spider, then look at a photo of a spider, look at a real spider, then in a closed box, then hold a box that has a spider in it. I know if you don't have a spider phobia, I know that now you say, why you are doing all of this? Because people who have phobia, if you let a spider crawl on their shoe, in their shoes, they're gonna have a panic attack, they're gonna collapse, and some people will have a heart attack just with exposing them. Because there is another form of therapy that we do, flooding. Flooding mean like a sudden exposure to the thing, but they found it can be very catastrophizing for the patient. It can be very devastating, causing even a heart attack or loss of consciousness. So we go gradually with the hierarchy of source of fear. So as we see, let the spider crawl on your shoe, let a spider crawl on your pants, let a spider crawl on your sleeves, then let a spider crawl on your bare arm. Okay, even if you have kids who have some phobia, you can use this. I'm sure you have seen some kids, they don't like spiders, they don't like animals, they don't like dogs, and you can do these stuff. But again, if it is a mild form of phobia, yeah, you can do it yourself. But if it's a severe form of phobia, you will need a therapist. Another example here, someone who have phobia for bridge, like to drive over a bridge. Why? And if you ask them, they tell you bridges will collapse if I got over it. Then you tell them, okay, how about we visualize driving over a bridge? Just imagine that you drive, or some people driving over a bridge. Okay, then watch. How about we go watch other cars drive over a bridge, and how about you drive over a bridge yourself? Okay, and I just had a patient 2 months ago. He have a big problem with, and part of his work is to drive, and part of his work, he's an engineer, and he wanted to drive over, and there is bridges all the time. So it ended up, they did the gradual exposure, and the psychologist, he was seeing a private psychologist, and the psychologist was going with him in every exposure to driving, so to drive with him. This was effective. And he was was taking also antidepressant. Okay. Anyway, another way of treating phobia, especially, so we learned one skill today. If you have a phobia towards something, gradually expose yourself to the source of fear. Okay. If you can't do it yourself, you need some help from a family member, a friend, or a therapist if it is a severe form of phobia. Another way of helping people with phobia is silver lining. Especially people who have a negative traumatic experience in the past. Okay, you try to replace their negative experience, switch it to create more a positive aspect of this negative experience. For example, and I talked about this a lot in the past, when there is a negative experience, try to think about it as a learning opportunity. So if you went through a divorce, okay, it is a negative experience. When you recall the experience, think about it as a learning opportunity. What did I learn from it? Okay, maybe I learned from this experience of divorce that I gained lots of coping skills. Maybe now I better understand people who going through divorce. Maybe now I can help others who going through divorce, and not just understand, I can also help them. I can volunteer in places that are helping single mother because I went through the same experience. And I went through divorce, but it could be worse. I have seen people who are going through domestic violence or are going through different types of abuse because of the separation or before the separation. So you see, with any negative experience, we can get something positive. We learned something, we understand something, we are able to help others more. What we are in, it could be worse, or what we are in prevent a bigger problem. Sometimes I talked a lot about this. When we are going through a problem, sometimes this problem is preventing a bigger problem. So yeah, people who have phobia, or have fears or trauma towards something, we try to do like a silver lining toward it. Another way of treating phobia is to try to replace the negative cognitive distortion with more rational ones. So you remember the gradual exposure? Okay, while you are exposing yourself to the source of fear, try to replace the negative thoughts about it, like the bridge, for example. This guy who have fears about the bridge, he's overestimating the threat. So you tell him, okay, yeah, the bridge could collapse, but the percentage or the chances that a bridge will collapse, how much is it? Maybe 0.00001. Okay, chances you're gonna fall down while you are walking and you broke your arm is higher than the chances that you are driving over a bridge and the bridge collapse. So you are overestimating the threat. And some people also catastrophize. They expect the worst gonna happen. Because I was bitten by a dog 20 years ago, it will happen. Or they overgeneralize because of I was bitten by a dog. This means any dog will bite me. Or they do the emotional reasoning. Emotional reasoning means what I feel become reality. You know, they say, oh, driving is very dangerous because I feel that it is very dangerous, or I have lots of anxiety toward it. So emotional reasoning means what I fear, I think it is real. No, but if you look, especially people with mental health problems, sometimes our feeling, as they say, it is our intuition. No, sometimes you know, if you have depression or an anxiety, you can't really use your feeling to judge the situation. Okay. Another way of treating phobia is the survey method. You know, as I just mentioned it, if you have phobia toward the dog, you can ask yourself this question: how many people died in a month by a dog bite within your community? How many people died because of that? You were bitten by a dog. It's very rare or almost none. Okay, so you can use this survey method to ask yourself how many people died because of this source of fear. And if it is very rare, there is no point with having this anxiety. Another way of treating phobia is decatastrophize. Okay, you know what catastrophize mean? You expect the worst gonna happen. It's not just in phobia. You will learn from the CBT course that catastrophizing happen with all mental health problems. You expect that I'm going to lose my job, then I will become a homeless, then I will not find food or shelter, then I will die on the street. So you see, and then you have this scenario in your mind and you catastrophize the situation, then you live in it. And we call this anxiety. Also, we catastrophize with the source of fear. Okay, but how to decatastrophize? We ask the patient, what is the worst could happen? Okay, and then if let's say it happened, how are you going to cope with it? So let's say you have fears about losing your job. What is the worst that going to happen? Oh, I become homeless. Okay, if you become homeless, how are you going to cope with it? Oh, I'll go to mustard seed, or I will go to a homeless shelter, stay there, or I will apply for Ish, or I will apply for Alberta. So I'll try to find. So even the worst that even it is very seldom to happen that the worst is going to happen, but still you are able to cope with it. What if you are bitten by a dog? Oh, I'll see the doctor. Maybe I'll need antibiotic. Maybe I'll need stitches, and that's it. So you try to decatastrophize the situation. Okay. This is a good technique for people who collapse because, or they lose, or they faint because of phobia. You know, is if let's say you have a phobia toward the spiders, okay, and you're gonna faint if you see a spider. How I'm gonna prevent the fainting? Can do the tension therapy method, which is you contract your arm, okay, and you contract your legs, and you contract your abdomen, like you do like this. You squeeze all these muscles, the legs, the abdominal muscle, and the arm muscle. Why this contraction will elevate your blood pressure a little bit, so prevent the fainting. So again, contraction on arm and legs and the abdominal muscle. It's like embryo position. Try to squeeze yourself. Anyway, there's different types also for treating this for kids. There is also EMDR is very effective for phobia as well, but this is very specialized. And you know, there are some therapists in Calgary who have the license to practice this one, and you could use it in severe form of phobia. Anyway, again, how we're gonna treat phobia? If I have phobia, you know, easy. We can do the gradual exposure, okay? And then we create a hierarchy of the situations that we are afraid of. And we go through them, start with the easiest one until you go to the toughest one, okay? Try also to find a meaning for a negative experiences that you went through. Let's say you were bitten by a dog, or you were bullied by your friends or by your colleagues at work, or your co-worker, or at school, and this caused you severe social phobia or severe social anxiety. Try to find the silver lining or the learning opportunity in every negative situation. Also try to replace the negative thoughts with more or irrational thoughts with more rational thoughts. Also ask yourself how many people died in a month because of dog bite or a spider or a bridge collapse or something, and find it is almost or none. Okay, and then your mind, if you have an anxiety, your mind, oh, maybe it is 1%, and the 1% will be me. Okay, but if you look logically or realistically about how you think, you are doing so many things that can cause harm, but you're still doing it, but you just don't think it. You become hyper focused and hyper attentive of one source of fear, and there is hundreds of stuff that can cause harm in the world, but we still use it and we still encounter. So, and we call this is a CBT therapy, is to try to replace the irrational with more rational. Decatastrophizing is to imagine what is the worst that could happen and how you're gonna cope with it. Contraction of all muscles in the body if you lose consciousness, and EMDR if you feel like you tried the gradual exposure, you tried the counseling, you tried the medication, and you need something different. EMDR stands for eye movement desensitization and reprocessing. Anyway, maybe in a different session, I'll explain more what does it mean. The question for discussion today: what are your biggest fears? It could be phobia, you can call it phobia, or just a fear, like it's not to the level of phobia, which is intense and anxiety. And tell me how you're gonna cope with it, or use any of these tools. So I give you some tools to use. Tell me if you wanna use a gradual exposure, or maybe you wanna replace your irrational thoughts with more rational, or tell me maybe you wanna add some silver lining to a past negative experience, or maybe you want to use this contraction of muscle in certain situation, you know, or maybe counseling or whatever. So tell me, what is your biggest fears, whatever it is classified as a phobia or just a fear toward something, and tell me how you're going to cope with it and what tools you're going to use to cope with it. I will give you a few minutes to think about it, then Brooklyn will run the discussion. Thank you.
So I'll give you about 6:10. And if you want to think about your check-in maybe for